Any general advice or recommendation on how to help improve gut health / fungal issues? Great question. I'm a believer in gluten-free over here. So I think, and vitamin D. So vitamin D regulates your tight junctions. I know we've mentioned that multiple times, but check your vitamin D. And then a lot of times I think, and depending on the patient and what's happening, it's really important to pull out, start with a very basic diet, and then you can try to identify what type of issues you might be experiencing if you're having an allergy or a response. But I think a lot of processed gluten actually is very hard on the gut, and I'm a believer that gluten-free is probably, especially if anybody who has any type of autoimmune disease, I think every time you eat gluten, you're aiding in that inflammatory pathway over and over and over and over. That's my spiel, but I'm sure Michelle has more things on the fungal issue as well. Anything else?
Well, it's about finding out what's there, and then eradicating fungus out of the gut it takes time. I mean, it can take a year easily. But you've got to work with a really good provider that really understands the difference between SIBO and SIFO. There's two different, and the nuances between the side effects or the symptoms associated with, small intestinal bacterial overgrowth versus fungal overgrowth. Those side effects are nuances. They're just very, very slight. And there isn't just one therapy. Some people start with nystatin, like 1 million units 3 times a day for at least a month, and then evaluate. And perhaps that therapy will go on for 6 months or more. And then at what point do you potentially add an azole or another antifungal? Really, it depends on the progression of symptoms. How are they evolving? How are they changing? And just because you're treating fungus doesn't mean you shouldn't be treating bacteria. So you gotta test. I'm going to back that up. You don't always test, because quite honestly, the treatment modalities are going to be the same whether you test or not. But when you're dealing with other kinds of gut issues, that's when it's nice to have a clearer picture. You also have to take a look at motility, right? Because a lot of times when you have bacterial changes, overgrowth or undergrowth, and fungal overgrowth, you have motility issues. And so that's where, again, dealing with a really good gastroenterologist, whether it's a naturopath or an allopath, is very important. Treatments are individualized. They have to be individualized. There isn't a cookie cutter way of treating anybody.